cancer cell actually shed small particles of their genetic material into the bloodstream, which are called circulating tumor DNA. Traces of circulating tumor DNA can be detected in the blood and analyzed using advanced digital sequencing technologies. With just a simple blood draw, i.e. liquid biopsy test, allows the treating oncologist to tailor therapy according to the genomic profile of the tumor. These findings in liquid biopsy report help oncologists to understand existing mutations in a tumor without the complications and delays of a tissue biopsy.
First and foremost, liquid biopsies are non-invasive and also a low-risk procedure, which reduces the patient's burden and the potential for adverse events associated with tissue biopsies. In addition, liquid biopsies are more convenient to perform, which can be particularly beneficial for patients who require frequent monitoring or have limited access to healthcare facilities.
This was a multi-center cohort study done in Israel, where newly diagnosed advanced non-small cell lung cancer patients had both standard tissue-based genotyping test and NGS-based liquid biopsy ordered on the same day. From the study, we concluded that performing liquid biopsy upfront is feasible and accurate and allows a shorter time to treatment in lung cancer patients, especially when tumor tissue is scarce.
Recent research has shown great interest in the field of minimal residual disease detection and recurrence monitoring using ctDNA-based assays. Much of the research has been focused on colorectal cancers, but we can see data being generated in other cancer types like lung and breast cancers as well. Ultimately, the goal is to improve outcomes for our patients. Using ctDNA-based MRD tests, we can identify patients who are ctDNA positive and are at high risk of recurrence, or patients who are ctDNA negative, and intervene, of course, appropriately.
Liquid biopsy and tumor tissue genotyping both have their advantages and disadvantages. Tissue genotyping has been the accepted standard of care for molecular analysis and has its role also in histological diagnosis and certain immunohistochemical testing. Liquid biopsies are minimally invasive. They can better capture tumor heterogeneity and also clonal evolution, and has a rapid turnaround time. With the results from both liquid and tissue, there is increased detection rate of clinically relevant mutations in metastatic non-small cell lung cancer, and we can be more confident of the treatment that we choose.
One of my patients, who was a young lady with a spread of cancer to the bone, lung, and came in severe pain, was given chemotherapy with immunotherapy. At point where I could see that she was in fact not responding, I was surprised to find an ALK mutation, which is commonly seen in lung cancer. I stopped chemoimmunotherapy. I gave her alectinib, and it was an absolute stunner how in a matter of days she had clinical improvement. Matter of weeks she was functional, and at 3 months on a PET scan she was in metabolic CR, which in my mind has changed the patient's outcome for now, and I can see for foreseeable future. This is a metastatic triple negative breast cancer, and we all know the outcomes of that.